Good afternoon, Dr. Oglaza. Thanks for joining us today. I was just wondering if you maybe had a message for our community moving into the long weekend.
Yes, as we continue into the sixth wave of COVID-19, prevention strategies depend on all of us taking simple action to decrease transmission. And with the upcoming holiday weekend beginning tomorrow, many of residents might be making plans to gather with loved ones. And we know that spending time with those who are close to us is important. It's critical for mental health. So if you're planning to gather with others, I encourage everyone to assess your risk and the risk of others attending the gathering. We know that the risk of infection and severe disease differs for different individuals and is more serious for some, especially those who are immunocompromised, individuals with underlying health conditions, and older adults.
So are there specific steps you could give us to help protect those, especially those at highest risk?
Yes, and I fully realize that this is not the news we wanted to hear before a long holiday weekend, but the safest course of action is to wear masks in indoor settings, particularly in situations where physical distancing might be difficult or impossible. Consider keeping your gathering smaller and limiting the number of contacts outside of your own household. And think about taking your gatherings outdoors, or if they're still happening indoors, please consider keeping windows and screen doors open to increase the airflow. And most importantly, stay home if you're sick, even if your symptoms are mild. And what's really important is we recognize that if someone may have symptoms even mild, we encourage them to get tested. And if they use a rapid antigen test, even if that test is negative and someone still has symptoms, I do encourage them to stay home and do not attend any gatherings when someone is symptomatic, feeling sick. And again, for those who have symptoms, getting tested and if eligible, getting treatment are the key strategies in which that risk of severe COVID could be prevented, reduced.
So you talked a little bit about treatment there. Can you explain a little more, like what treatment? Is it antiviral treatment? How does that work?
So there's different treatments available, and they really depend on the individual situation. It might be different for different individuals. That's something that should be a discussion between each individual in a particular health condition and context with their primary healthcare provider, and that might have already happened as part of routine follow-up care that takes place. So there are different options. There are antiviral treatments. There are treatments that are not antiviral, but still are beneficial in those who are infected. So having that understanding that someone might be at increased risk and a plan what to do if they are symptomatic and test positive, that would be the best plan that individuals could do. But I also wanted to encourage everyone to get all vaccination doses they're eligible for. And for those who are 60 years of age and older, that means a fourth dose. And what's really critical here is that booster doses are significantly reducing the risk of severe illness and lower the risk of transmission. So that's really our first line of defense against COVID-19.
Is there anything else you'd like to add in closing while heading into this weekend?
I think this is, as we are into the sixth wave, this is we've done this before. We've gone through various waves of COVID-19. And this is the unique time in this pandemic where we have really powerful tools that can reduce the risk and protect the most vulnerable ones. So while we still need to practice these basic infection prevention control measures, we also need to take advantage of everything that's at our disposal to reduce the risk and protect each other. So I keep repeating that getting vaccine, I know it's the message that everyone heard many times, but it becomes really important now that we know we have evidence that vaccine not only protects against severe illness, lowers the risk of transmission, but also reduces the risk. There's emerging evidence that it reduces the risk of post-COVID complications. So what we heard about long COVID, that's something that can be, the risk can be reduced through vaccination. That's really goes back to that main message is that the vaccine-induced immunity is the best way of getting protected, much better, much safer, much more efficient, effective than infection-induced immunity.
That's very good. Thanks very much for meeting with us today.
Thank you.
And I hope you have a good long weekend as well.
Thanks so much.